Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
What are the familial cancer syndromes which are involving a non-medullary thyroid cancer? So, what are the familial cancer syndromes involving non-medullary thyroid cancer? So, we have Cowden syndrome first. We have Cowden syndrome. This Cowden syndrome occurs more commonly due to the mutation of the gene P10 gene mutation will result in Cowden syndrome. A patient with Cowden syndrome will present with intestinal hematomas and the patient will also present with benign and malignant breast tumors, and in the thyroid tumors the patient will present with mainly the follicular carcinoma of thyroid. Rarely the patient presents with parathyroid sorry rarely the patient presents with papillary thyroid carcinoma and also Hurthle cell carcinomas. This is Cowden's syndrome. Now, if the patient has familial adenomatous polyposis, this familial adenomatous polyposis occurs mainly due to the mutation of the gene APC is responsible for familial adenomatous polyposis. If the patient has familial adenomatous polyposis, then the patient will present with colon polyps or cancers. The patient might present with polyps in the colon or cancers and also desmoid tumors. In the thyroid carcinoma, the patient presents with papillary thyroid carcinoma, especially of cribriform pattern. Then, if the patient has this Werner's syndrome is a defect in aging mechanism. It occurs due to the mutation of WRN gene mutation causes Werner's syndrome. This Werner's syndrome has a uh, manifestation of adult progeroid syndrome. That means in Werner's syndrome, the patient will look like an old man. There is early aging is seen in Werner's syndrome. This is mainly because of the helicase defect. So because of the helicase defect, the patient will have early aging in Werner's syndrome. In Werner's syndrome, the patient can present with either papillary thyroid carcinoma, follicular thyroid carcinoma, or anaplastic cancer. Then we can also have Carney's complex type 1 disease. Now in Carney's complex type 1 disease, here in Carney's complex type 1 disease, here this occurs mainly to the mutation in PRKAR1 gene mutation causes Carney's complex. In Carney's complex, the patient will present with cutaneous myxomas, or the patient might present with breast and adrenal tumors. Regarding thyroid cancers, the patient will present with either papillary thyroid carcinoma or follicular thyroid carcinoma. Then the last syndrome associated with thyroid cancer is McCune-Albright syndrome. This McCune-Albright syndrome mainly occurs due to the mutation of the gene NAS1 mutation causes McCune-Albright syndrome. In McCune-Albright syndrome, the patient presents with fibrous polyostotic fibrous dysplasia with endocrine abnormalities, and the patient also presents with KFA lutein spots. And coming to the thyroid abnormality, the patient in McCune-Albright syndrome presents with papillary carcinoma of thyroid, especially the clear cell type of papillary carcinoma of thyroid is presented by McCune-Albright syndrome.
thank you and thank you for watching.